So before I come to the strategy, let me say this. We can complicate something as much as we want. The real trick is in simplifying things. So what we heard inside about all those different platforms, mobile platforms, web platforms, complex technology, all that is real, all that is happening. But as doctors, as clinicians, as physicians, we don't have to worry about that. What we have to really worry about is how to use it, first of all, if at all we have to use those in personal capacity, and then how to actually make use of these technologies for the better clinical care. So if you now agree to this very simple definition or very simple problem statement and ignore all the noise that's happening in the environment around us, now we come to this strategy, right? So this simple problem has to have a simple strategy. The simple strategy is put the patient in the center of the healthcare, period. And when I say patient, I don't really mean to say sick people. When I say put common men at the center of the care. So now if you do that, all you need is how do you ensure that the population remains healthy? People don't fall sick. If they fall sick, how do we detect at an early stage rather than at a later stage? How do we prevent all the complications? How do we provide them the best possible care in the fastest possible time frame in the best possible setup? If we have to do all of that, we need to have a nationwide EHR, I should say, the whole record system, where one patient has, or one person rather, has one identity, wherever in the country they are, whichever healthcare system they are in, whichever IT system that particular institution is using, there is one system. So if I got a cough, I don't even need to go to a doctor most of the times, right? I mean, those grandma remedies, those dadi nani ke nuske, they're there. Right? No, what we don't understand is how real they are at any given point of time, or whether they are the best remedies at that point of time. So we have something called a symptom tracker, right? So now I'm translating that problem statement into a strategy. We got something called symptom tracker. You don't need to go to a doctor for that. Anybody can just be there, go there, put in their symptoms, answer some of the related questions, which the machine very intelligently links to my unique situation. It's not a standard question answer format. Anybody coming with cough, those 20 questions have to be answered? No. I'm a 40-year male, non-smoker, not with a history of any tuberculosis or anything. Having this cough, since I arrived in Bangalore this morning, I'm a unique case. Someone else, on the other hand, could be a 60-year-old gentleman who has a history of tuberculosis, has been smoking 20 cigarettes a day for the last 40 years, has had this problem for the last 12 months, and so many other correlating things could be there. Cases, our systems are intelligent enough to identify us as two different cases. So it's my personal data, my personal health history, my personal treatment history, combined with my present complaints or present symptoms that define the system, that the system uses to define what the next step should be. So the system asks me questions, I give the answers, it tells me should I need to worry or not. If I don't need to worry, then what do I do to get relief? If I have to worry, then what do I do? Do I need to go to the hospital now and I should call an ambulance, or can I wait till tomorrow morning? If I can wait till tomorrow morning, should I go and see a pulmonary physician straight away, or do I need to see a general physician? So this is very high level, assistance that the system provides and helps a patient make a better decision. And I'll be talking in a while about the clinical decision support. Clinical decision support is not just for clinicians. Clinical decision support is not just for nurses. It's not just for healthcare staff. It's for everybody. I need a clinical decision support as an individual. Symptom checker does it. Now come to a physician. Now the same patient. So I reach a hospital. System told me you need to see a general physician tomorrow morning. Okay, tomorrow morning I survived the night. I reach the hospital tomorrow morning and I tell the physician these are the symptoms I'm having. Now what does the clinician do then, right? You need another kind of clinical decision support where the clinician needs to use his own or her own existing knowledge, their own previous experiences, their wisdom, all their skills, and then make certain judgments and say what I need to do. And that's where again the system comes to my rescue. If I have a very simple use case, very simple symptoms, run on the mill, go just do hot water goggles, don't do anything, avoid dust and basically the polluted places, stay in house or whatever else, you'll be fine. That's a very simple remedy. So what my dadi would have told me just got verified by the doctor. On the other hand, the doctor could say, oh my God, you got severe respiratory allergy and you need to be admitted. We need to run some certain tests on you to decide what to do next. System is helping the clinician at every stage. Third stage, a system assisted the clinician arriving at a diagnosis. Clinician gave me a prescription. Let's assume in a very advanced setup it got an e-prescription and they enter certain things for the support staff to do. Now how does a nurse ensure that she has done exactly what the physician wanted to do, right? So that's again another kind of clinical decision support that comes. So what I'm trying to say is that at every stage we have got custom solutions for those specific parts of the problem. But at the heart of everything for us is the patient or a common man or a common woman rather, whose symptoms are what is troubling the healthcare system, and that's what's addressed using our system. So it's a very, very interesting way to look at it. But then if we actually use the right evidence, which is our strength as an organization, we use evidence-based clinical practice guidelines, and then we add data which is unique to a person, and then we add the clinical data and clinical knowledge to it, and then we add the specific environmental factors, and in certain cases even the genomic factors to that. We are able to personalize the healthcare we give to one individual at a time. So that's what we believe.